Hi, guys, and welcome. Hi, Nichi. Thank you so much for joining me today.
Hello, thank you for having me.
Awesome. So, guys, if you are joining us live today, we are speaking about carpal orthoses in canine rehabilitation, and we have Nichi Cockburn here with us from the UK. I'm quite excited about this conversation actually. So, Wimba is one of our sponsors for the Vet Rehab Summit. And as we were chatting to them about what's happening and what is coming up this year with the Vet Rehab Summit and our brain theme, they recommended that we reach out to Nichi and that we chat to you about carpal orthoses. So that is how we got in touch with you, Nichi, and I'm really excited about that. So can you please introduce yourself, tell us a little bit more about who you are and your interest in today's topic of carpal orthoses?
Yeah, of course. So yeah, my name's Nichi. I'm a vet physio and also a registered veterinary nurse. I run a busy rehab service in Cardiff in South Wales from a vet practice. My interest in carpal orthoses sort of developed a few years ago when I met a dog called Bernie, who was one of our nurse's dogs. She was a young Bernese Mountain dog, and she presented with a left forelimb lameness. So we imaged her pretty early on just because of who she was and her breed, etc., and found that she had early carpal OA in that left carpus. So as you can imagine, she's a growing dog, bounding around the place, super excited. Obviously, she was on analgesia, etc., but we were really mindful of how could we try and reduce the impact. And of course, her mum's trying to, make all the relevant home modifications and all that sort of thing, and it just wasn't working. So I started to explore the thought of putting an orthoses on for her. So contacted Wimber at that point because obviously I was looking at a lot of the ones off the shelf and stuff, and it just didn't seem appropriate for her. And I also wanted to know if it could work. So they were quite on board. So we placed that orthoses for her, and it made a huge difference, like an amazing difference to her and her level of lameness. So she did really well. And then about 5 months later, she presented with a lameness in the right fore. We imaged her again, and she then had OA in the right carpus as well. So then we did exactly the same thing again. So we placed another orthotic for her, and she still wears them now. She is now, she's fully grown now. She does mountain walks. She was up Penavon, which is one of our big mountains, just on the weekend. So she's living her best life because of because of the orthosis. So that's what sort of piqued my interest in them.
Okay, I love that. So she's continuing to wear them as a part of her normal day-to-day management.
She does,
yeah.
She's just doing normal general activity, just going for a stroll and stuff. She doesn't tend to need them so much then. But if she does go for bigger walks without them, her owner does notice an increase in her lameness score. So and she's fine with them. So she does really, really benefit from them.
Okay, I love that. So really giving you guys a tool to bring her from, that initial pain to a place where her pain is managed and her function is under control and good, and then something that adds an additional level of support so that her activity can increase and she can participate in life. I really love that.
Yes.
Okay.
Yes.
So guys, if you are joining us live, welcome. It is so good to have you. We are talking about carpal orthoses today with Nichi. Please feel free to share any questions or experiences or comments with us. We are here to chat with you, so join the conversation. Okay, so let's talk a little bit about the difference between an orthoses and a brace, because like you said, there are many kind of off-the-shelf kinds of products available, and then there are things like the Wimba braces. What has your experience been with some of the different kinds? How has your use of these devices changed with that experience?
Yeah, so over the years, I would say, if I'm quite honest, which I am terribly, I've not had the greatest experience with the off-the-shelf ones, to the point that I almost stopped reaching for them because I would either get rubs or they just wouldn't tolerate them, etc. So I've tried lots of different companies, and I might just be quite unsuccessful with that. It might just be me, but I just didn't get on well with the off-the-shelf ones. And I tried from tarsal ones, carpal ones, various other different types. And I've just never got on with them until, which is why when Bernie presented to me, I was like, oh gosh, you know, how am I going to help her? Which is obviously why I went down the Wimber route. And to be honest, since I've started working with the Wimber products, I just haven't looked back. And I've used so many orthotics since, you know, tarsal and carpal, and most recently the stifle ones for a cruciate that couldn't be surgically operated on. And I've just had such good success with them. And I think partly it's because, well, not partly, but massively it's because of the company. And just disclaimer, they don't pay me. Everything I say is my own comments, but they've just been, their customer service is just phenomenal. You know, from first point of contact to, I'm forever messaging them saying, can this work? I've got this dog. They'll ask for images. They get the engineers to look at it and they're like, no, Nichi, that won't work. There's too much hyperextension. That's just going to fail. So they're very honest about what works and what doesn't work. But also with some of the braces, the orthotics that we fit, we have to use the scan. So you set up a scan and they teach you through it. There's an app. It's all very, very, you know, easy to follow. But they literally, it's hilarious. I'm like, can you be on call with me when I do this? Because I don't know what I'm doing. And you know, because it's not a skill set that I've ever had. So they're literally, you know, from Poland, they're on call with me at a certain time and they're in the room with me with the owner while I'm scanning. And they're like, to the left, Nichi, lift the dog up more, you know, and they're literally, it's like they're in the room with me and I'm quite needy. And they're just super supportive. So I think they're very honest about what can work and what can't work. But then when the devices come, they're obviously purpose-made. They're lightweight. They can get wet. They can be washed, you know, so you can use them in hydro. So, you know, they've just been invaluable to me. And I've definitely used more orthotics since Wimber came along, because I probably was a bit disheartened with the other types. And like I said, maybe that was me and how I was using them. I just never got on with them. And I think obviously I'm not an orthotic queen like, you know, Diane Messam, for instance. You know, she is like the orthotic queen. She can make anything for anyone, which is like such a skill set that I absolutely don't have. And I think that, you know, in a lot of our training, we're not necessarily taught a lot about orthotics in our trainings. It's not something we come into practice knowing. So I think when you've got then support of, you know, engineers and, you know, a decent company, it empowers you to be able to fit stuff you probably wouldn't have done otherwise.
No, I love that, all of that, because I'm the same as you. Orthoses, that sphere, that space of what we do is fraught with all its own considerations and complications and things that we need to know and think about. And to have a company that helps you fill your own knowledge gap so that you can effectively use these tools to help your patients is incredible. So I really like that. What else is, this is not a conversation about Wimber, but I am very curious about the braces because they look very different from most other kinds. How do they differ? Can you talk us a little bit more through what they look like and how they work? Yeah.
Luckily,
oh, you do?
It wasn't planned. So yeah, they're basically, so for instance, this is like their demo one. So obviously you've got your hinge. So say this was your little dog Carpus then, I suppose. So they've got these sort of lovely inserts. And like I said, everything's made to measure. So they've got these inserts, which are like really soft. So they don't tend to rub like a lot of the, you know, like a lot of the braces we buy. They've got like stitching down the inside and stuff where maybe the aluminium splinters and stuff. So, you know, the real rub zones. So they don't tend to have the same rub zones as the others do. And then obviously these fit, and all of these things can be replaced. So if they wear, they can go and we can get another one and that sort of thing. So this one doesn't have any straps on it, but, you know, usually then they would have straps here and here, and then they're just little click straps. And you just, you know, the casing would open up and then you pop it on, do the clips up, and then off they go. But this way is like literally nothing. And I think that's even Bernie's braces, which were quite sizable, as you can imagine, for a Bernese mountain dog, they weighed nothing, they weigh hardly anything. So I think that's, and because they're so lightweight, I think that makes a real difference to the patient tolerance of them.
Okay. They're very nice. Are they, they're 3D printed, right?
3D printed, yes. Yes.
Okay.
I won't even pretend to know what the material is. I won't pretend to know what the material is. It's an amazing thing that I know nothing of.
Okay, perfect. Okay, well, we're not actually here to talk about Wimba, but
We're not,
a
no.
little sidetrack that I really wanted to go on. All right. So, you mentioned that for Bernie, you used it for carpal OA. What other conditions benefit from the use of a carpal orthosis?
So we've used them sort of initially sort of post carpal arthrodesis, when we've had an arthrodesis and we need to slowly increase the loading for them. So we've used them in that case where we can slowly change the joint angle or slowly reduce the support. We've done that a bit. We tend to, it's interesting because for me it was always sort of like the hyperextension injuries and stuff, or the hyperextension, carpal hyperextension dogs. You know, your German Shepherd that comes in with lumpsacral disease that has like massively hyperextended carpi, or, you know, those classic ones where you've had that cranial load from over a chronic period of time, and then you're slowly starting to get that carpal hyperextension. I found those ones quite handy. But again, I think since Bernie, I've changed my mindset a bit, and I'm almost using them a lot more proactively than I used to be. So before I was quite reactive, you know, sort of, oh, I now have carpal hyperextension, now I'm going to use it. Whereas now I think that there's definitely place, and I'm definitely doing this more with, you know, our tripods. So, you know, if we've got, you know, a forelimb amputation, or a hind limb, to be honest, but often with the sort of, you know, you've got one forelimb left, and then you know, we're chronically getting hyperextension of that or overloading of that joint. I've got one collie that we're just about to measure up at the moment called Griff. He's got a hind limb amputation, but he's starting to get painful carpi now, and we're starting to see that manifest, and he's probably 3 years post amputation. And in retrospect, I think I maybe should have probably fitted him or had the discussion with the owner to maybe talk about those sorts of things early doors, because this owner is very much like, you know, all preventative things. So again, I think that we can start using them much more proactively rather than reactively. And and again, I've got Max, who's what I'm just fitting. We're fitting him one at the moment, and he's a Labrador with chronic OA of you know, all of the joints. And now he's got a marked right forelimb lameness due to the amount of OA he's got. So now he's got sort of left internal rotation of his left fore, and it's almost really starting to deviate. So we're just fitting him now with a carpal orthotic, but with a foot, to try and like manage that compensatory overload. So I think before it was just the obvious things that we would, you know, we would use them for. Is now I think we can be really using them as part of our plan.
Yeah. Yeah, so as like part of an extended management plan for conditions in other areas, I think you're right. Amputees would be one of the first things where I'm like, this is a good addition to help. They just need all the help that they can get to live full, long lives. So I like that use. Let's talk a little bit about strengthening and therapeutic exercise, because of course, especially for like a secondary support, right? We have breakdown in another area and we're overloading the forelimb. We want to make sure that we're strengthening the structures, we're strengthening the carpus and the structures of the forelimb to support that weight. How do you balance a therapeutic exercise program with the use of an orthoses?
Yeah, so I still do all of their therapeutic exercise stuff as normal, definitely, because for me, a lot of the orthotics is to allow them to live normal daily lives, to be able to do what it is they enjoy doing, you know, go on the walks, be with the family, those sorts of things. So I'm still, depending on the level of engagement of the client, of course, I'm still, where possible, trying to get them to do their, you know, their therapeutic exercise plans. They're still doing their, you know, their hydro or whatever. They're still doing all of those things. One of the biggest things actually is when I've fitted well-fitting orthotics and they take to them really well, is trying to make sure the owners don't get them to wear them all the time. That's one of the educational things, because they're like, oh my God, he's fabulous with it on. But so that's something I've had to try and manage, and also trying to make sure they're still doing their exercises, because like he's absolutely fine now. He just wears his orthotic and he's fine. So that's required quite a bit of education and me checking in, like, are you doing your, you know, the usual, are you doing your exercises? The question we have to ask every day. So that is one of the things that I have to keep an eye on, that the owners are actually still doing the exercises I prescribe to them, because often they're not.
Okay, so they like to just use the orthosis and then forget about the bits, the other bits.
Yeah, when they fit really well and they're using it well, they're like, oh, I don't need to do any of these things. So yeah.
Okay. All right. So in that vein, what advice do you give owners to ensure that they're using it correctly, and that the dog has a successful outcome when they're using a carpal orthosis? What are the challenges that you find the owners face as well? I think those go together.
I think one of the big things is reminding them that it is a mechanical support device. It is not fixing everything. It is a device to support us with daily living. And that is one of the biggest barriers, is if, like I said, when they do work well, they try and rely on it heavily. So I'm mindful when we first start using it that we've got sort of like a slow introduction to them using it. We slowly habituate the dog to it so they can get used to it, because obviously it is, it's a massive thing, somebody having something on your limb. So depending on the dog's personality, I'll slowly integrate it into their normal everyday activity. So we'll start with sort of like literally like just getting them to familiarize them with it, and then slowly we'll get them to wear it and slowly increase the time. Almost like when you're slowly progressing your therapy to exercise, it's almost you're doing that with your orthotic and getting them used to it. But it's they can never be left alone with the orthotic. That's one of the rules. They can never be left alone if they've got it on. So if they have it on, the owner has to be present with them, definitely. And then there's often good advice with the Wimber stuff. There's really good advice about how to clean them, how to take them apart, all that sort of stuff, so that we're not getting, sand rubs or sort of foreign body rubs and that sort of stuff within it. Because of course it's only as good as it is clean. So it's making sure it's dry, it's making sure it's clean, those sorts of things. Because again, otherwise you'll just get those rubs. And once you get those rubs from a brace or anything, they take so long to heal. So then you can't then use your device, etc. So it's about the sort of appropriate integration into using it, then making sure that it's managed well and is kept lovely and clean. And also, I think body weight being one of the biggest things, as with everything that we do, making sure we're getting these guys as lean as we possibly can, just to, again, stop that, reduce the overload.
Yeah. Okay, great. So that's some really good advice. Thank you. You mentioned some of the things that can go wrong in terms of complications. Are there other complications that you encounter when you're using specifically a carpal orthoses?
I haven't actually. No, I think I've probably been quite fortunate in that respect. I haven't had any rubs with these ones. I've had lots of rubs and stuff with other ones previously, but I think I've been really fortunate. And Bernie's owner, for instance, she doesn't listen to me because obviously, she knows me, so she's not going to listen to me. So Bernie probably does a lot more than I would recommend, but it's worked for her. Okay. It's been fine. She's doing really well. But yes, but no, I've thus far, fingers crossed, I've been fortunate that I haven't really had any issues with them.
Okay, that's amazing. Can you talk to us a little bit more about using carpal orthoses with hydrotherapy together?
So we've obviously, when you have the orthosis on, then you've dictated the flexion and extension angle, you've dictated the range of motion of that limb. So all of that will obviously depend on what you're working on, obviously, in the tank, because if you're fixing that limb in a certain position, then of course they're only going to move in a certain position. So it depends on what you're working on. It depends if you have if you're able to change the flexion and extension angle, the range of motion of your orthotic to allow movement as well. So that you need to obviously take into account that, because they won't be able to perform their normal degree of, say, carpal flexion, etc., or extension in the tank as they would do normally on land. So the moment they've got the orthotic on, of course, we're dictating how they move. So we've got to be mindful of how our biomechanics look when we're exercising. So some patients, we've got one that wore a stifle orthotic because he's completely disrupted all of his stifle, and he did really well in the tank with his on, but then we've got another one that we don't, because she just doesn't do well. She's much better, her movement pattern is much better when she's moving freely with the support of the water. I think it's being aware that you fixed an angle, and how are they now going to move considering that we fix that angle, and then obviously adapting your treatment protocol depending, and removing it if you need to.
Okay, no, I love that. Look at the patient in front of you and then adjust accordingly, is a lot of what I'm hearing. I love that. If there is one thing that you want our listeners to take away from this conversation, what would it be?
Ooh. I would say that don't be scared to use them, because I think since I've started using them, I'm like, gosh, this, if I look back at patients and think, oh God, I really could have helped you more than I did. Or, you may have had a better quality of life. You may have gone further. It's, so I would say, don't be scared to use them, and don't be scared to reach out to people who are using them to ask for advice. Because I think that's the biggest thing in our profession, isn't it? And something that I think that, you're very passionate about is, when you qualify as a physio, all that time ago, you qualify, and then you are on your own a lot of the time in practice, aren't you? And you can feel quite isolated. And I know there's lots of like mentor programs and that sort of stuff coming out, which is brilliant, but it can be a lonely world when you're just here in your consult room for 15 hours a day. And other than reaching out on the groups and stuff, you don't really know what to do. So I think that reaching out to people that are using them and asking their advice, speaking to people like Wimber who have all of the advice and all of the support, and like me when I'm like, will this work? No, Nichi. Just reaching out and just asking, because I do think there's probably a lot of patients that would have benefited from that type of support. And so don't be scared to use them, don't be scared to reach out, and also think about them proactively rather than reactively. Think about them for all these compensatory overloads, and if we're using them early doors, how much of a difference can we make to these guys?
Okay, that's really, really good. I love that. You were making me think now. I do believe that the Canine Rehab Institute now has a certification program for orthotics and prosthetics, which I think is amazing, because I do feel like it's a gap for so many of us. I know very little about actually using them in my patients. So I think that is a fantastic addition to our industry. I think many more of us will be doing that. And I love that you've found a company that will tell you, no, that won't work.
Yes.
It's always great to be able to work with people who will try things, who are willing to like innovate and figure stuff out, because we're just like, I think this is what I want to try. I don't know if it'll work. Can we try it? But it is even more valuable to actually have a company that's going to say to you, that is not a good course of action. Ultimately, we are protecting the welfare of the dogs that we're working with. And so that's a huge vote of confidence from my side. So I appreciate that. Thank you, Nichi.
You're welcome.
All right. To our listeners, if you do have any questions, please do leave them in the comments and we will come back to them. I have loved chatting to you, Nichi, about this topic. I think we could probably have some more conversations in the future. What do you think?
I'd love to, absolutely. I'm glad it didn't bore you to tears.
No, not at all. Not at all. Thank you so much, guys. Have a wonderful day.
It's cool. Take care. Thanks so much. Bye-bye.